You gotta go back to. Welcome and good morning. My name is Jessica Harold and I am the Fee for Service Operations and Quality Assurance Manager in the Medicaid Division of the Oregon Health Authority. Thank you so much for joining us today for our Oregon Health Plan Substance Use Disorder 1115 demonstration request for extension public hearing. I'll be facilitating today's public hearing. We will be recording this meeting for the purposes of sharing with members of the public who cannot attend, and we are currently being live streamed on Facebook or YouTube. Please remember that this is a public meeting. We are live on YouTube and the chat is subject to public record. If you have any connectivity issues, please contact Liz Lord. Next slide. Thank you. As you can see, we have today's agenda showing. First, we're going to do a little housekeeping. Then we're going to do a waiver overview, which will include waiver background, extension request overview, intentions and goals, extension request details, timeline, public comment opportunities, opening for public comments, and then we will close the hearing. And next slide, please. So first we're going to go over some housekeeping. Our presentation will not be paused while it is in session. This public hearing is being live streamed via YouTube and recorded. The recording will be available on OHA's YouTube page and posted to our SUD 1115 waiver website as soon as possible. Everyone's voice matters. Keep comments focused to allow others the space to be heard. Questions will not be answered today. If you have any, please send those to sud.waiver@odhsoha.oregon.gov. Opportunities for discussion will be announced publicly as they become available. A sign-up sheet will be passed around for the in-person attendees who wish to make a comment. If there's remaining time, we will be available for additional comments. OHA staff will remain present until the scheduled hearing time is complete. Next slide, please. Virtual attendees may raise their hand at any time during the presentation to queue for comment. Comments will alternate between virtual and in-person participants. Please wait to be called on by name. Each comment is limited to 3 minutes. Please state your name and organization if applicable before making your comment. Virtual attendees should type their name, organization, and email in the chat if commenting. This can be done anytime. If making comment virtually, when completed, please lower your hand. All public comments will be summarized and shared after the comment period closes. Next slide, please. The SUD 1115 demonstration waiver is a special approval from the federal government that allows states to test new approaches in delivering Medicaid-funded substance use disorder services, or SUD services. Under Section 1115 of the Social Security Act, states can apply for waivers to implement innovative treatment strategies, expand access to care, and improve outcomes for individuals with substance use disorders. These waivers give states flexibility to implement programs that may not fit traditional Medicaid rules, such as covering new types of services or making changes to eligibility requirements to improve care and reduce costs. Next. And here on the slide are some key facts about Oregon's section 1115 waiver opportunities. First, let's explore a little background together. OHA committed to transforming its SUD treatment system to improve access, equity, and outcomes for Medicaid beneficiaries. To achieve this, OHA sought federal partnership through an 1115 demonstration waiver, focusing on strengthening the state's continuum of care for SUD treatment. Approved by the Centers for Medicare and Medicaid Services, or CMS, in April 2021, the waiver set Oregon on a path to implement evidence-based practices, enhance provider capacity, and to integrate culturally responsive and co-occurring disorder services across the state's behavioral health landscape. This waiver expanded service delivery options so OHP members with a wide range of needs would have access to the appropriate level of care. Pardon me. This foundational work undertaken during the initial waiver period, which is April 8th, 2021 through March 31st, 2026, has laid the groundwork for lasting systemic improvements while highlighting ongoing challenges and opportunities to further expand and refine the system. Next slide, please. The state of Oregon is requesting a 5-year extension for its substance use disorder treatment delivery system. Through this extension, Oregon's efforts will lead to better health outcomes for those individuals with substance use conditions. Oregon will explore aligning the SUD waiver period with the Oregon Health Plan, or OHP 1115 waiver period. Oregon anticipates this change will not only reduce the administrative burden on reporting requirements of 2 separate waivers, but also create better opportunities for alignment of waiver goals and measurements under Oregon's Medicaid quality strategy. The additional period will support Oregon's efforts to continue developing the SUD continuum of care throughout the state and demonstrate the impact of care for individuals at all stages of their recovery. This extension will further enable Oregon to effectively implement the necessary changes to the Oregon Medicaid Management Information System, or MMIS, provider portal to offer the $5,000 lifetime benefit to individuals as they transition from a residential setting to their own home through the Community Transition Services, or CTS, offering. Oregon is also requesting new expenditure and waiver authorities to provide contingency management to individuals diagnosed with a substance use disorder. Contingency management is designed to motivate individuals in recovery by offering incentives for meeting treatment goals. Contingency management is an especially beneficial treatment option for stimulant use disorders. Unlike opioids, there are no FDA-approved medications to treat the use of methamphetamines, cocaine, and other stimulants. Evidence shows contingency management to be the most effective evidence-based therapy to improve outcomes, including the decrease or termination of drug use, and longer participation in treatment among those with stimulant use disorder. The goal of adding contingency management to support Oregon's treatment programs directly supports the improvement of the continuum of care by providing a structured, evidence-based approach to reinforcing recovery behaviors. We have an FAQ, or frequently asked questions sheet, available here today in person, and we will drop a copy into the chat for those who are attending virtually. Next slide, please. Just to reinforce, this additional 5-year period aims to support the growth of a full continuum of care enhancing access to quality treatment, increasing treatment engagement, reducing repeat visits to emergency departments and inpatient care, and improving outcomes for individuals with SUD. Help Oregon implement needed updates to the MMIS system, allowing individuals to access a $5,000 lifetime benefit when transitioning from residential care to independent living through Community Transition Services, or CTS, and implement new expenditure and waiver authorities to provide contingency management, improving outcomes, and fostering more sustainable care. Next slide, please. The state of Oregon worked setting 4 waiver goals, outlining what our demonstration is setting to achieve. These are going to be the same moving forward, with the implementation of contingency management to support each one overall. The first goal is to assist Oregon in increasing identification and engagement of Medicaid beneficiaries diagnosed with SUD. The second is to assist the state in increasing beneficiary adherence to and retention in SUD treatment programs. Assisting Oregon in reducing inappropriate or preventable utilization of emergency departments and inpatient hospital settings through improved access to a continuum of care services, and to provide a continuum of care to increase the chances of Medicaid beneficiaries of having a successful recovery process. Next slide, please. Thank you. Central to the approved waiver is the focus on enhancing residential and inpatient treatment services as a crucial component in the continuum of substance use benefits. It accomplishes this by permitting Oregon to receive federal funding for Medicaid services for individuals with a substance use disorder in residential treatment facilities with more than 16 beds, or as CMS refers to them, institutions for mental disease. The other major component of this waiver increases the service array for Oregon Health Plan members with substance use disorder to include community integration services composed of housing and employment support. Oregon is implementing this benefit to help people transition from institutional and residential settings to their own homes within their communities. The added flexibility from the waiver to provide these services has furthered Oregon's goal to prevent, identify, and treat people with substance use disorder and help them sustain long-term recovery. Next slide. The state of Oregon is expanding its treatment options by adding contingency management to its existing demonstration programs. Contingency management is designed to motivate individuals in recovery by offering incentives for meeting treatment goals. This benefit will be available through Medicaid participating providers who opt in and receive state-approved training. Contingency management will be offered alongside other therapeutic interventions, such as cognitive behavioral therapy, and will be modeled after successful programs in other states and Oregon's own state opioid response initiatives. Contingency management is one of the most effective behavioral interventions for the treatment of substance use disorders. Contingency management is an especially beneficial treatment option for stimulant use disorders. Unlike opioids, there are no FDA-approved medications to treat the use of methamphetamines, cocaine, and other stimulants. Evidence shows contingency management to be the most effective evidence-based therapy to improve treatment outcomes, including the decrease or cessation of drug use and longer participation in treatment among those with stimulant use disorder. Next slide, please. Key initiatives, including codifying flexibilities and Oregon administrative rules, adopting a consistent ASAM framework, and improving provider licensing and certification, as well as staffing, have laid the groundwork for sustainable progress. The assessment conducted by Oregon Health and Science University and Portland State University in October 2022 further highlighted areas for improvement, leading to increased provider reimbursement rates and the establishment of ASAM 3.7 residential care. Additionally, Oregon has extended its efforts beyond integration services, creating pathways for crisis intervention and early recovery support. These expanded services have not only strengthened the state's continuum of care, they have also successfully reduced emergency department utilization statewide. As a result, Oregon continues to lead by example in addressing substance use disorder, providing a comprehensive and accessible system of care that prioritizes recovery and community reintegration. So again, just to revisit the key points we've talked about. Updated rules for SUD treatment. Oregon has made key updates to rules for residential and outpatient addiction treatment. Enhanced support programs. New reimbursement programs support outpatient services and licensed professionals providing co-occurring disorders care and culturally specific services. Rate increases and workforce support. Behavioral health providers received a 30% rate increase funded by Medicaid savings. Additional funding in December 2023 helps address workforce shortages by supporting hiring and training efforts. And expanded Medicaid services. New billing codes have been added to expand services available to Medicaid beneficiaries. And updated education and prescribing guidelines. OHA has updated opioid prescription guidelines to follow the latest CDC recommendations focusing on patient-centered care. The prescription drug monitoring program helps providers follow safe prescribing practices and stay within federal and state rules. All right, next slide. So looking at our timeline from the beginning and moving forward, we made our initial waiver application in 2020 and it was approved in 2021. We are currently in our public comment period, which will end on March 20th, and we expect to make our extension request to our federal partners by March 31st. The process of review takes about a year, and if we are approved, we could look toward better aligning with our OHP 1115 waiver and begin our new period of waiver services in 2027. Next slide, please. Okay, on the next few slides, we have an overview of the different ways public comment can be submitted over the course of our open public comment period through March 20th, 2025. As you can see, comment can be given in written formats via mail and email at these addresses. We're just going to leave that up just for a second. All right, next slide, please. Further, we will be offering another public hearing in Portland for additional public comment opportunities. Accessibility or accommodations are available via request. Please email if needed, and you could just email on the screen. I'm going to read that one more time. That's sud.waiver@odhsoha.oregon.gov. Now we will begin. Oh, sorry, next slide, please. Now we will begin the public comment submission period. We are still in a public comment period. We have no one in person, and when you enter, please raise your hands. For the folks who are watching on YouTube, just want to do a quick check-in. We are still here. We are still in our public comment submission period. And if you'd like to join, please raise your hand and we will call on you. We do not have anyone in person at this time. Checking again, to let you all know that we are here to take your public comment. Thank you.
Go.
All right, I just wanted to do one more quick check-in. We are going to be here for another 10 minutes. I do have a couple more slides after public comment period is closed. So I will leave some time to do those. For those of you watching on YouTube, we are here awaiting your public comment if you choose to provide one. Thank you. All right, we are going to go ahead and close the public comment period. Again, if you would like to leave a public comment, can you get us the next slide? You can always send it to the email address. All public notices, draft requests for extension documents, and related details are available on our website. And there's a link there, and we can go to the next slide, please. Here is the the email address again. To submit public comment, sud.waiver@odhsoha.oregon.gov. We appreciate the time you've allowed us to spend with you today. Please reach out to us anytime with questions or concerns. Thank you all very much, and I hope you have a wonderful Tuesday.